HoLAP laser is a multi-purpose surgical laser. Its ablative and hemostatic properties make it ideal for the surgical treatment of BPH. The HoLAP procedure selected depends upon the size of the prostate and the surgeon's experience level. HoLAP ablation is a safe and effective outpatient procedure for smaller prostates. Improvements in urinary flow and symptom scores are immediate and comparable to TURP, but with fewer patient complications. It is easily learned and often completed in 30 minutes. Patients do not require transfusions, have catheters routinely removed the morning after surgery, and are routinely released in less than 24 hours to unrestricted activity. The equipment needed for performing HoLAP ablation includes a high-power HoLAP laser, 26 French continuous flow resectoscope, and a side-fire fiber. The VersaPulse Power Suite 100-watt HoLAP laser is preferred, although a 60 or 80-watt system may be used. The inner sheath of the resectoscope may be modified with a guide to stabilize the fiber during treatment. The duotone side-fire fiber is preferred because the laser energy is delivered at a 70-degree angle, making it easier to maintain the laser beam perpendicular to the prostate surface. The recommended laser settings are 2 joules and 50 Hz for the 100-watt laser. The settings may range from 2 to 3.5 joules and 20 to 50 Hz depending upon the power of the laser and physician preference. HoLAP ablation is generally performed under general, spinal, or epidural anesthesia, and saline is used for irrigation. The side-fire fiber is fixed within the endoscope. The red aiming beam is used to show exactly where the treatment beam will be delivered. Starting at the bladder neck, the laser is activated. The fiber is moved back and forth to ablate or paint the tissue. The fiber tip should be held against the tissue to be most effective. The back and forth movement is continued until the tissue is ablated sufficiently and an adequate channel is created. As much tissue as possible is removed at the bladder neck and in both lobes to create a large prostatic cavity. 1 gram or more of tissue can be ablated per minute. The HoLAP laser ablates without charring or overheating tissue. Since the absorption depth is only 0.4 millimeters, tissue is ablated faster than heat is conducted into the surrounding tissue. The resulting "what you see is what you get" effect contrasts to the coagulating effects of ND-YAG and KTP lasers. Their wavelengths penetrate deeper and extend below the visible tissue surface. As you can see, hemostasis with HoLAP is excellent. The tissue is effectively sealed, providing hemostasis superior to electrocautery instruments. This means the procedure is virtually bloodless, providing a clear field of view for the surgeon and few if any post-op complications for the patient. A 20 French catheter is placed at the completion of the procedure and usually removed when the patient is discharged and voiding adequately. The HoLAP laser can be used in a variety of ways, including treatment of BPH. HoLAP ablation is a simple-to-perform technique with a short learning curve. It is a minimally invasive procedure for smaller prostates that provides immediate symptom relief with little risk of side effects.